I know you've written or been interviewed before on this topic, but can you just tell us kind of some of the areas the current mental health system can do better in terms of obstacles facing the industry?
There are so many.
Yeah.
Don't even know where to start, I think. When I think about areas of investment for healthcare, I often think about cost and access and quality as three of the big ones to try to get the best mix of all three. And if you think about those areas when it comes to mental health, we clearly have an access problem. There is a massive shortage of mental health professionals across the country, and in some states it's worse than others, but really in any state, just the number of licensed providers of mental health services relative to the number of people in those states is just far too low. So there's definitely an access problem. I think from a cost perspective, it costs the system so much to treat mental health illnesses already in this country, and we've seen them only get worse. I think when I dug into the space a year and a half ago now, we were spending as a country over $200 billion a year treating mental illness across different levels of severity. And we saw that about half of Americans at some point in their life would have a mental health issue that needed to be addressed. And so it's just an enormous cost to the system. And people were often paying out of pocket for that. So, super expensive to see a therapist if your insurance company doesn't cover it, which in a lot of cases they don't or haven't in the past. And there wasn't much on the through employers that was available, even 2 years ago. And that's starting to change and is one of the things we're excited about. But the cost has just been prohibitively high for the vast majority of folks over the last decade and more. And then I think quality, hard to measure in this space, certainly, which is one area that we think about in our investments relative to other areas within healthcare, like diabetes or areas where you have really great consistent data. So that's been an issue as well, is just saying, what does a good provider look like? And then also, what do good outcomes look like? How do we measure outcomes over an extended period of time for people who are engaging with the mental health system? So across all three areas, lots of room for improvement,
Right.
Lots of issues that still exist today, but I think that creates a lot of opportunity for the companies that are starting and trying to tackle this space.